Everyone, we're going to go ahead and get started. I want to be cognizant of people's time. Welcome. My name is Naomi McLeod, and I am the Program Director at APDA's Virginia chapter. Thank you so much for joining us today. I am pleased to welcome you to our webinar series, our program designed for people with Parkinson's, as well as their care partners, family members, and healthcare providers. We're very grateful to have Lisa Lane from Wings Over Hospice for volunteering her time to present on today's topic, the role of hospice care in Parkinson's disease. After some brief announcements, Ms. Lane will make her presentation, after which there will be a Q&A session where you'll be able to ask questions about today's topic. So the American Parkinson's Disease Association, Virginia chapter, APDA Virginia for short, is part of the largest grassroots network dedicated to fighting Parkinson's disease and helping the more than 1.2 million people in the U.S. live life to the fullest. The APDA Virginia chapter offers a variety of services to our constituents around the Commonwealth. Please visit our website to explore all that we have to offer. Our website also hosts a wealth of information on publications, webinars, programs, and research updates that can help you understand Parkinson's disease. If you are participating from another state, know that we have other chapters and locations all around the U.S., and you can find their contact information on our website as well. The bottom line is APDA is here for you. During the presentation, if you have any questions, please feel free to ask them in the Q&A section on the bottom of your screen and click submit. After the presentation, Ms. Lane will answer any questions with the time that we have allotted for a Q&A. And now to introduce our speaker for this afternoon, Ms. Lane. Lisa Lane has served as a visionary leader and advocate for seniors adults for over 30 years. In the early years of her career, she served as a sales and marketing director, meeting with families and healthcare professionals regarding assisted living facilities and memory care placement. She traveled to multiple states under Life Care Services to provide support and training in senior living communities. She then joined Fairfax Publishing and became the regional manager of Senior Living Guide Publications and Web for the state of Virginia. After 18 years of service, she accepted a position at the largest private duty agency in Hampton Roads. Lisa has served several board positions and served as a chair of multiple committees throughout her career. Currently, she is proud to be a liaison at Wings Over Hospice, and she is currently driven by the realization of a real need to educate and provide resources to families, whether they are in the process of long-term care planning or in crisis. In her free time, Lisa enjoys traveling, reading, biking, gardening, and spending time with family and friends. Please welcome Ms. Lisa Lane.
Good afternoon, everyone. Thank you so much for taking time out of your day to learn more about hospice and how this service may benefit you or maybe somebody you know. So today, we're actually going to talk about the role of hospice care in Parkinson's disease. So let's get started by going to our next slide and really understanding hospice care. 25 years ago, when hospice was first introduced to this country, often patients were referred in the late stages of the disease process as they were transitioning or actively dying. So the patient was only on service a couple of weeks or maybe just a few days, meaning that neither the patient nor the family really had the opportunity to experience all that this beautiful service has to offer. The best thing you can do when thinking about your wishes and your long-term care plans and goals is to understand all about this benefit before you need it, because you can share that information with family and friends who may be going through something. So we want to go to actually the next slide and talk about what is hospice. It's actually support and care for those with life-limiting illness. It recognizes dying as part of the normal process of living. The true gift is to see how much can be shared towards the end of life through personal and spiritual connections that are so often left behind. People don't really talk to each other, towards the end of life. They're grieving, they're hurting, they're in crisis. Hospice helps find out what the patient's goals are and the family's goals. And if possible, we can help the individual and the family obtain those goals. It might be a graduation of a loved one, or maybe the marriage of a child, or welcoming a new grandchild into the world. They want to see that. Well, I can give you a testimony of a lady that we helped at Wings Over Virginia. We recently had a patient. She really wanted to attend her loved one's graduation. And if you've ever been to a high school or a college graduation, you know how much walking you have to do. You got to find parking, and it's always a good hike from the parking lot to the building. And the buildings are never small, so you got to get from point A to point B and find your seat. Well, this lady was really having some mobility challenges, and she did not think she could go. So we were able to locate an electric scooter. That's a whole nother story. One of our patients had one that she wasn't using. And we were able to get it to this patient, provide transportation to get that scooter and the patient to the ceremony. Her aide that volunteered, the aide that helps her every day, actually volunteered the day of the ceremony to go in early and get her all ready for the day, curl her hair. And she was able to reach her goal and attend that ceremony. That was a great day for that patient. But on the flip side, sometimes when I meet with families and we're just starting to open up conversation, we're learning about hospice, I sometimes hear, Lisa, I don't want to give up. I want to keep fighting. And there's that negative connotation. Hospice is not about giving up. Hospice affirms life. It doesn't hasten or postpone death. Did you catch what I said? Hospice affirms life. It's about living your best life until. Nobody knows when our time's going to come. Not one of us has an expiration date on our forehead like a carton of milk, do we? So I hope you agree that it's very important to make the very best and most time that we do have together with our friends and our loved ones. And that's a big part of what hospice is all about. It focuses on the quality of life, not just for the individual, but also for their family caregivers. Because you can't provide great care for someone else if you're not taking good care of yourself. If you've ever been on a plane, when the flight attendants are preparing for takeoff, what do they instruct the passengers to do? Before you help your family or your friend, put on your oxygen mask first, right? In other words, take care of yourself. Taking care of yourself is going to help prevent caregiver burnout. This is a time to ask not just family, but also friends to pitch in. Maybe you need to take a break or run an errand. So often we hesitate to ask others for help. We don't want to put anybody out, or maybe we think we can handle it. And that's fine for a while, but over time, we can become totally overwhelmed. Years ago, I heard a pastor say, when you decline help that's offered, you actually rob that individual of a blessing. Because we feel good when we help someone out, right? What about as we age and maybe our adult children no longer live close by? Maybe it's a relationship that's taken them away, or a marriage, or a job opportunity, and they live in a different state. Maybe our social circle is starting to become smaller and smaller as we age, and we really don't have anyone we can rely on. Did you know that the hospice provider can also help connect you to other resources? So let's move on and look at slide number 5. Features of hospice care. Patient and family-centered team care approach. And we're going to talk about our team in a few minutes. Hospice provides a range of services such as case management, medications and supplies, medical equipment. Maybe an individual has become unsteady and they're starting to have mobility challenges, like that lady we talked about. Hospice can provide a walker, a cane, a wheelchair. And as the patient's disease starts to progress and they decline, they might need a hospital bed that goes up and down, or oxygen to make it easier for the patient to breathe. Other features include grief support, volunteers. Volunteers can come in and play music or sing. You wouldn't want to hear me sing, but they can play cards or maybe bring a therapy dog, something that's going to cheer that individual up. Let's talk about the hospice team members, moving on to the next slide. I want you to picture a wheel with the patient and family right in the center of that wheel. Wrapped around the patient and the family are the hospice physicians, also known as the medical directors, counselors, chaplains, social workers, spiritual bereavement, aides are CNAs, certified nursing assistants, and we'll talk about what they do in a few moments, therapists, nurses, and volunteers. So let's go on to the next slide and talk about the actual work of the hospice team. Next slide. What does the team do? Well, the physicians or the medical directors that we just looked at, they oversee the medical care of the patient with an emphasis on pain management and symptom relief. And that can alleviate multiple trips to the ER and prevent hospital readmissions. So many things can be taken care of right at home or wherever it is the patient's residing. Physicians attend monthly meetings with the team to discuss patient care and symptoms, talk about how they're doing, and make recommendations. I know at Wings Over Virginia, we meet every other week to discuss our patients. That's more often than what's actually required by insurance. Physicians are on call in the evenings and weekends to address any immediate and urgent needs. Nurses admit the patient to service. They sit with the family and develop a plan of care with the patient. They help manage the pain and the symptoms and provide wound care. The patient has a wound. They're available to make visits in period of crisis or acute symptoms. There's always a nurse on call 24/7. I know for our team, we actually have separate nurses on call in the evenings and on the weekends. We don't want our nurses that are working in the day to actually have to work in the evening on the weekends too. So we have separate nurses for that, including a nurse practitioner. Social workers and counselors and chaplains, they attend to the emotional and psychosocial, spiritual aspects of passing away and caregiving too, with the end goal of peace for the patient and the family. Social workers are full of resources. For example, private duty services. Maybe a caregiver, family caregiver is still working and they're kind of starting to feel overwhelmed. They got too much on their plate. Maybe there's a special out-of-town event, such as a wedding, and the patient really can't travel. Social worker can help arrange a respite care. They can make recommendations for certain facilities while their family's away. Therapist. Maybe a patient can benefit from a little therapy regarding a sit to a stand position or transferring. Volunteers. We kind of touched on what volunteers can do. Let's go to the next slide. Where is hospice provided? Anywhere the patient resides. It can be at the patient's home. It can be at the home of their loved one. It can be in an assisted living facility, a nursing facility. Sometimes hospice is provided comfort care in the hospital or a care home. You know, these care homes are really becoming popular over the last decade. It's a smaller setting where there's a lot of one-on-one care. Maybe the patient ratio is 1 to 5, as opposed to an assisted living or a nursing facility where those healthcare workers have a lot more patients. But hospice can go anywhere the patient is. So kind of keep that in mind. Let's go to the next slide. Because you probably are thinking at this point, this sounds like a great benefit, but who pays for all of this? Your insurance, Medicare, Medicaid, private insurance, some HMOs. Sometimes it's a combination of some of these. And if you're ever in doubt, you can always call a hospice agency and they can help guide you. Let's go to the next slide and talk about who can qualify. Admission criteria. You know, there's a myth floating out there that says hospice is for old people. That is simply not true. Hospice is for anyone, meaning if the patient has a life-limiting illness and the prognosis is 6 months or less if the disease takes its normal course. Of course, that's not a guarantee. There's patients that live well beyond 6 months. We have patients on service over a year. As long as they continue to meet the requirements of hospice, then that benefit and that service will remain in place. Did you know that there's evidence that patients under hospice care actually live longer and with more quality of life once their pain's managed and their symptoms are under control? So let's talk about that. Let's move into our next slide. Talk about hospice as it pertains to Parkinson's disease. When is the right time? Let's look at some identifiers. Starting with unintentional weight loss, meaning an individual that loses 10% of their body weight in a 6-month period. You might think, well, gosh, Lisa, that sounds like a lot of weight, but not really when you break it down. For example, if there's a female that weighs about 140 pounds and she loses 14 pounds in 6 months, that averages out to just a little over 2 pounds a month. Some patients don't really weigh themselves, so they might have noticed their clothes are starting to become really loose or baggy, and maybe they've gone down a size. Let's move on to difficulty walking. Patient might be having multiple falls. Individuals starting to use a device like a cane, a walker, a wheelchair. They're falling a lot and ending up at the emergency room. Or maybe it's multiple hospital readmissions going back and forth, and they're just tired of doing that. They don't want to go back to the hospital. Frequent bladder infections, also known as a UTI, urinary tract infections, or maybe it's other chronic infections like pneumonia. And what about behavior disorders? Actual changes in the brain. Could be a little depression, or maybe they're becoming anxious, disillusions, confusion, hallucinations, bouts of crying for really no reason. Dysphagia. I know we don't have that listed on our wheel here, but difficulty swallowing, choking, making it difficult to eat certain foods. This can bring about a change in a diet over time. The patient might not even realize that they're kind of leaning and adapting to softer foods like mashed potatoes, macaroni and cheese, soups, shakes, yogurt, that sort of thing. More dependence on loved ones and caregivers. Maybe the person can no longer drive because it's just not safe. If you can't drive, you're not really getting out in the community as much as you used to. And that can bring about periods of depression. Or maybe they're embarrassed, so they become withdrawn. Or the patient may no longer live alone for various reasons. Maybe they've had to move in with a loved one to help take care of them. Difficulty communicating. It might take some time to put words together, to get their thoughts out, making it difficult to communicate the needs. Family and friends can sometimes become impatient, and that increases the frustration of the individual, almost like a catch-22 situation, right? These are all indicators that it might be time for you to reach out and ask some questions. So right now, I'm going to tie it all up, and I'm going to take a few moments. Next slide, Naomi, to answer any questions you may have. So I'm going to ask Naomi to help me by opening up the chat. I'm going to turn my camera on. There you are.
Right.
And answer any questions you might have.
Well, thank you, Lisa, for a very insightful presentation. I'm hoping that the listeners today were able to learn a little bit more about hospice care and to change the connotation that can be looked at as hospice care into more of a positive experience. So I have some questions that were sent ahead of time, and I'm going to ask those questions to you. So the first question that I have, what are some strategies you can use to balance listening to medical experts and advocating for your loved one who is on hospice?
Oh, that's a great question. Do your research when it comes to strategies. If you do have a hospice provider, if your loved ones, if I'm understanding the question, Naomi, this is somebody that's already on hospice?
It just says, what are some strategies you can use to I'm assuming so. Yeah,
Okay.
they said a loved one who was on hospice. So what are some strategies that you can use?
Okay. So the number one thing I would advise you to do is talk to your team. It's a partnership, right? You always want to let your team, your case manager, your nurse, your hospice organization, let them know if you have any concerns. And if you're not getting those concerns addressed, it's your right to transfer. Sometimes people think that because they're on a hospice service, they're kind of locked in and they have to stay on hospice or they have to stay with that individual company. If you're not happy and you've given that company every opportunity to actually improve and make it right, you have the option to transfer. I would always do your due diligence. There's a lot of good content on the website that's listed below on this slide, the National Hospice website for palliative care and hospice. There's some great questions on there, a lot of good content. I would advise you all to go onto that website, and that will give you a lot of good information too. But communicate, talk to your team.
All right, so the next question I have is kind of walk me through, especially, as your role as a community liaison, if a person or family is considering hospice, what is that transition like? What are the steps that are taken? So can you kind of walk us through, if a family's interested in hospice care, how is that done initially?
Yeah, so that can come from all different types of branches on a tree, right?
Mm-hmm.
What you have to have in place in order to actually have hospice service is a physician's order for a consult and treat, right? So the first thing we want to do, if we're concerned, is talk to our physician. That could be your loved one might be in the hospital, or it might be as simple as going to your PCP and open up that conversation. Do your research. Not all hospice organizations are created equal. So you want to go online and do your research. And even if your provider gives you choices of different hospice companies, I would advise you to go online, go on their website and call and interview those companies, because one size does not fit all. And even though there are, insurance requirements, some hospices do things a little differently. I know that we accept a lot of patients and can identify them really early on to get them the service that they need. So that's one step that I would do too. You've got to have that physician's order in order to start service. So talk to your healthcare professionals. And of course, we in Virginia, if you're local here in Hampton Roads, you can always call Wings Over Virginia Hospice. I don't know if I'm allowed to share that phone number or not, Naomi, but
Yeah, good.
you all, if you're interested and she's given us permission, I'll go ahead and give you that number, which is 757-392-9681. And we're happy to direct your questions and field answers.
Perfect. Another question that we received. First, is there a limit to, first, are antipsychotic medications typically used in hospice treatment?
That is a great question. And I would say that depends on the individual. I am not a nurse. And I am not going to pretend to be a nurse. That's more of a clinical question. So I think that depends on what's going on. Each care plan is individually tailored for that individual. So that's a good clinical question. And we can always get an answer to that, Naomi, offline, and you can reach out to that individual.
Okay, perfect. Another question that I received, I think this is kind of similar. What other types of resources would you suggest for someone in hospice who may live in an area with limited health resources?
Oh, that's a good question. Depending on what type of resources that you're looking for, as we talked about in one of the previous slides, the social worker for your hospice, since we're talking about an individual that's already on hospice, generally has a wealth of those area resources. She's got a toolbox of tools that she can help the individual and point families in the right direction. If it's there's usually senior organizations too in every area. I know here in Virginia we have the senior services, and they have a lot of resources, and wherever you are, you should have some sort of a senior program.
Okay, perfect. Another question that we have, do the rules and laws of hospice in Virginia apply to the state of Washington? I'm assuming, I'm not quite sure. Every state is different.
Every state is different as far as some of those things go. I would definitely look at your individual state, just like Medicaid of Virginia probably has different, restrictions and things and guidelines than Washington State would have.
Okay. Do you know what portion of hospice is covered by Medicare?
I do, 100%. If you have Medicare A, 100% of hospice is covered.
Well, that's good to know. I did not know. I did not know
and
that
most
either.
of those insurances that we talked about, some of your private, some of the combos, you have to, when you're going into a facility, right? Medicare will cover the actual hospice portion of it. We can do hospice in a facility. What they don't cover is the room and board of the facility. That's an additional cost. And sometimes patients might have a long-term care policy that will pick up those costs. Often they might have Medicare and Medicaid could pick up those costs. So there's different options there.
Okay, perfect. Another question that we have is, how do you balance medical direction from a healthcare provider and allowing the person on hospice to still maintain some kind of dignity?
That's a good question. You know, you're the boss, you're in control of your own and your family when you can no longer speak to your, you know, we need to question, some of the things that we have in mind, or, you really have to advocate. You have a good hospice team. They're going to answer your questions. If they're not answering your questions to your satisfaction, then probe more, ask more, Don't be afraid of healthcare workers. Some people are intimidated, by physicians and nurses and things like that. They're there to help you and to guide you.
Okay, well, that's great. Well, I don't have any more questions. Does anyone else have any questions before we transition into the end of our program? You can feel free to ask them in the Q&A section. I'll give it a second or two if anyone has any last minute questions to do so. So, Ms. Lisa, before we close our last minute announcements, do you have anything that you want to end to say or end your on hospice before we kind of transition? Any last minute words or whatnot?
Sure. Let's leave here today and not think of hospice in a negative, right? We've heard a lot of good information, good positive information. And when in doubt, reach out to your hospice agencies in your local area. You can have public speakers come and talk to your senior groups at church. We liaisons are more than willing to have phone conversations with people. It's all about education, right? When you are trying to make a big decision, you want all the education that you possibly can get. So don't be timid or afraid to reach out to other people and ask questions. There are no dumb questions when it comes to your healthcare, right?
Well, thank you, Ms. Lisa, and we'll add your contact information and the site for Wings Over Hospice in the follow-up email, as well as the website at the bottom of the page for an additional resource. So thank you so much for being here. We did receive one comment that said that they were a hospice chaplain and that they thank you for your presentation. It was very positive and well done. So thank you so much for being here. So before we close out, next, we're now doing our webinar every other month. So our next webinar will be November 19th at 1 p.m., exactly 1 month from today. Then we'll have Dr. Zawar, who is a doctorate of physical therapy, discuss managing pain in Parkinson's disease. So I want to thank everyone for being here today. And again, thank you, Ms. Lane, for an insightful and positive presentation on hospice care and how we can support our loved ones with Parkinson's disease, and as a resource for a positive experience and improving quality of life. This webinar was recorded, and if you have any questions or in a follow-up email will be sent out with the recording and additional resources that were mentioned. And we look forward to seeing you in November. If you have any questions, please feel free to contact our chapter. We are always here to help and support. So thank you so much for being here, and we look forward to seeing you in November.